Hi everyone. My teaching is based on Al-Husseini's integrated cardiovascular notes, which combine first aid concepts with detailed explanation and real-world-oriented clinical correlations. So I will start with embryology. So let's talk about the development of the heart. As you know, the first organ in order to be developed in the fetus or embryo is the heart. So the heart will beat by the week 4 of development, approximately at the end of the first month of gestational age. So as simple as that, the embryology of the heart or development of the heart will start as 2 endocardial tubes. These 2 endocardial tubes will merge or combine together to form the primitive heart tube. And this primitive heart tube composed of truncus arteriosus and 4 dilatations. So this is truncus arteriosus. This is bulbus gordius. This is the primitive ventricle, and this is the primitive atrium. The last one is the sinus venosus. And here is the first aid picture. This is the primitive heart tube. This is the truncus arteriosus. This truncus arteriosus will form later the pulmonary artery and the aorta, primitive ventricle, atrium, and sinus venosus. As we know, the normal heart consists of these chambers, 4 chambers, 2 atrium and 2 ventricles. This is the pulmonary artery, the blue, and this is the aorta. So the atrium is above, and ventricle and arteries below, within the lower portion of the heart. So here there will be rotation of the atria. There will be rotation of this truncus arteriosus and ventricle downward, and elevation and rotation of the atrium and sinus venosus upward. So the heart develops through a stepwise process, and by birth it should reach its final functional and anatomical form, which is this form. So at birth, the normal human body should contain this heart form. And in order to reach this form, there are several steps in embryology. First, we will start with atrial septation. This primitive heart tube will be dilated. So the first step of heart development, the heart will be composed of the primitive atrium and a primitive ventricle. So the primitive atrium is about single chamber, which later will be divided into right and left chambers. So we will start with atrial septation, then we will talk about ventricular septation, truncus arteriosus septation. Before we start with the atrial septation, you have to know a rule. I call this rule the golden rule. So what does the golden rule says? The golden rule. The golden rule says, as long as the fetus is within his mother's uterus, there should be an opening between the two right and left atria until birth. That means after birth it's allowed for this opening to be closed, but during the pregnancy there should be opening or foramina between the two chambers. Let's see how does this golden rule will be applied. So we will start with atrial septation. Atrial septation will be start as from the roof of the primitive atria. This septum will start to arise downward until approximately the midway so at the midway it will stop. This is called the primary septum or primum septum. This space or window in which there is no septum, it's called foramen primum. Okay. Here, between the primitive atrium and the primitive ventricle, there is what's called endocardial cushion. This is called endocardial cushion. And this is endocardial cushion is amazing because what? Because it will be stimulated by what's called a neural crest. And when it's stimulated, there is septum arise upward until it meets the primum septum. So there is now complete septation of the primitive atrium. But remember our golden rule, there should be an opening as long as the fetus is within his mother's uterus. So there is a pregnancy. As long as there is a pregnancy, there is no complete septation between the right and left atrium. Why? Because the blood needs to bypass from right to left in order to give oxygen to the aorta and goes to the rest of the body. So by apoptosis here at the upper portion of the primum septum, a foramen will be formed. So this foramen is called foramen secundum. So before, just a little, there was a space called foramina primum. This foramina primum was closed by this septum which was arised from the endocardial cushion. So it was closed. Again, by apoptosis or programmed cell death, at the upper portion of the primum septum, foramen secundum was formed here. Why? In order to the blood to bypass from right to left. Why is from right to left the blood is bypassing? Because in fetus, the right side of the heart and the atrium has higher pressure than the left side. Not like the adult or the baby after delivery, in which the pressure in the left side is larger than the right side. No. In fetus, the right side of the heart has higher pressure, so the blood will be pushed and shunted from right to left. So this foramen allow this. The next step of atrial septation is that here another septum will be arised from the roof of the primitive atrium. So here, but at the right side of the primum septum, another septum will descend like that. So it will overlap this foramen and this septum. So again, it's closed. And this is against our golden rule. Remember, as long as there's pregnancy, there should be an opening present. So this is closed. How it's not allowed? Again, here there is a foramen by apoptosis will be formed here by apoptosis or programmed cell death. Okay, and this is called foramen ovale. It's called like that because oval means ova. Okay, so it's oval shaped foramen, and this foramen will allow another shunting of blood from right side to the left side. And we said, why does that happen? Because the right side of the heart has higher pressure than the left side of the heart in fetus or during a pregnancy, because the right side contain the blood that is coming from the inferior vena cava and superior vena cava, which has higher pressure in the fetus. Okay, so now atrial septation stops here. The delivery happened. So after delivery, the golden rule says this opening should be persist until birth. Until birth should be closed. It should be closed. So after birth, the child will start to breathe. The pressure will start to decrease in the right side of the heart, while the lungs and pulmonary vein will start to pour blood within the left chamber of the heart. The left side of the heart will have higher pressure than the right side of the heart. This pressure will start to apply force on this septum, so it will push it like that and make it fuse with the septum secundum, and this is a process called fusion. This is fusion between the septum primum and septum secundum, and by this process the heart announced that the atrial septation has been completed and closed. Of course, this will be merged, as we said, together. But in some patients, the two chambers and the foramen ovale, for some reasons, such as low oxygen or high prostaglandin, there is no closure of the foramen ovale. So there is continuous connecting between the right side and left side. So this is called ASD, or atrial septal defect. So in your world, there is a question says that adult patient came with symptoms of stroke, such as unilateral weakness or side weakness or focal neurological deficit. So he said, what is the reason? What do you expect because of this stroke? So one of the choices is failure of fusion of septum primum and secundum. So you can expect that he means atrial septal defect, because we mentioned that the last process is a fusion of the primum septum and secundum septum. So he says failure of the fusion of the septum primum and secundum means atrial septal defect, and this paradoxical stroke passed into the right and went into the left ventricle and passed within the aorta, and it went into the brain. So this leads to stroke